Welcome, everyone. Thank you so much for joining us for this event, Fighting Mask Bans, Building Pandemic Solidarity, plus up-to-date info on how to stay safe from COVID. Displayed right now is a slide that says, Fighting Mask Bans, Building Pandemic Solidarity, plus up-to-date info on how to stay safe from COVID, with a picture of a bullhorn. Feel free to introduce yourself in the chat. My name is Allegra Heathstout. My pronouns are she and her, and I'm Director of Emergent Campaigns at Senior and Disability Action. First, I'll share some notes on access. I will now spotlight our ASL interpreter. And Grace, you can take down that slide for now. Thank you. Great. Sean is our ASL interpreter this evening. Sean will be visible throughout the event tonight. Thank you so much, Sean. We also have a captioner, Kelly. Thank you so much, Kelly. To turn on captions, you can press the CC button at the bottom of your screen. And if you have access concerns or questions at any time, please use the Q&A function and we'll do our best to address them. I'm joining you from Ramita Shaloni Land, also known as San Francisco. I know that we have people here tonight from all over the United States and beyond. And as we organize both locally and across borders, let us honor and fight in solidarity with the Indigenous peoples of all of our lands. As I mentioned, I'm with Senior and Disability Action, or SDA. SDA is a San Francisco-based organization. We mobilize and educate seniors and people with disabilities to fight for individual rights and social justice. Through individual support and collective action, we work together to create a city and world in which seniors and people with disabilities can live well and safely. We work on a wide range of issues, including housing, transit, healthcare, and of course, pandemic justice and masking. This event is brought to you by Masks for Equity, a group of Senior and Disability Action members. In a couple of minutes, Elizabeth, one of our members, will share more about Masks for Equity. But first, I want to thank the organizational co-sponsors for this event. 1021 Members for Palestine, Care Not COVID Chicagoland, Center for Independent Living, Carbon Humanity Collective, COVID Action GSO, Long COVID Justice, Can End It, People's Hub, and World Health Network. When we began planning this event a few weeks ago, we had no idea that over 800 people would register and so many amazing organizations would join us. In the face of mask bans spreading across the country, I'm heartened to know that all of us here tonight and so many more people we're connected to are ready to join together for the safety and liberation of our communities. Thank you all for being here. So a few notes on what to expect tonight. We are in webinar mode, so only our planned speakers will be visible and audible, but everyone is welcome to participate in the chat. Building connections is one of our goals. So feel free to share in the chat, but please be mindful that this is a large event and be respectful and kind in what you write. Well, we're all here to learn. We do have a team monitoring the chat. They will try to remove people or delete messages if they feel it's necessary, or they may even turn off the chat if it's getting hard to manage. But it's also okay if that's too overwhelming. You can just listen to our speakers and take in what we're sharing. We will send out a recording of this event later to everyone who registered. We can also share a recording of the chat for access purposes by request. Email me for that. So do note that this means if you type in the chat, your name may be shared later. So you might want to change your Zoom name if that's a concern. You can also share a question via the Q&A function, either anonymously or with your name. We won't have a dedicated Q&A time, but we will gather those questions to inform our future work. And again, the Q&A function is probably the best place for immediate access concerns. Also, all of our speakers, as a reminder, please speak slowly and clearly and describe all text and images on your slides out loud. We wish we could have more time for back and forth engagement tonight. This is just a brief introduction or a brief discussion of this topic, but we really look forward to engaging with you more over time. So now I'm going to turn it over to Elizabeth to share more about Masks for Equity, the group bringing you this event, and then I'll share more about what to expect for the rest of this hour. Elizabeth?
Sorry about that. Didn't realize I was muted. Thanks, Allegra. My name is Elizabeth. My pronouns are she and her, and I'm a member of Senior and Disability Action. Sorry, my camera is off, but I'm so glad to be here with you all and to share a little background on Masks for Equity. So like Allegra said, Masks for Equity is a working group that's part of SDA, not a separate entity. We have a bunch of different working groups that focus on different issues. And this one started in spring of 2022. Just want to thank Shauna Reeves and Alyssa Matros so much for their contributions to this section. So here's an overview of some of our history and some things we've done. SDA hosted an online teach-in town hall on the importance of keeping masks on Bay Area Rapid Transit, or BART, and AC Transit during COVID-19 surges in 2022. And SDA has hosted numerous call-in actions to Oakland City Council, AC Transit Board of Directors, BART Board of Directors, the San Francisco Health Commission, and Alameda County Health Department meetings, calling for continued mask mandates in public settings, healthcare, and on public transit. We've also had many in-person rallies and demonstrations. When we started this working group, one of the first things we took on was a big push to get masks reinstated on our biggest local public transit agency, BART, starting around March of 2022. We held several meetings with elected BART directors and staff asking for an extension of the mask mandate for BART. Our efforts were successful on multiple occasions, and BART became one of the last transportation agencies in the United States to require masks. They brought back the requirement for 3 months. We pushed again at the end of that 3-month period and got it extended again. And then we pushed again, but that time it did not get renewed, but we were successful multiple times before then. And then in December of 2022, we organized a holiday caroling protest outside Oakland City Hall with Vice Mayor Kaplan and Councilmember Kolb, who co-introduced legislation requiring mask mandates for all city buildings, including public libraries and senior centers. The action was successful and the legislation passed. Months later, through subsequent advocacy and legislation, Oakland extended its mask requirement through July of 2023. And then in March of 23, right before healthcare masking requirements were set to expire in California, Oregon, and Washington, we partnered with other West Coast advocacy groups and activists for a West Coast Week of Action. We called on government officials and healthcare facilities to keep masks in high-risk settings, such as healthcare, jails, homeless shelters, and nursing homes. At the end of that week, SDA organized a funeral-themed protest, a funeral for public health, outside the Alameda County Department of Public Health, demanding an extension of mask requirements in Alameda County nursing homes, hospitals, and clinics. In June of that year, 23, SDA co-hosted the training Fighting for Safe Access in a Mask Optional Healthcare Environment for DREDF, or Disability Rights Education and Defense Fund, for seniors and people with disabilities wishing to request reasonable accommodations in healthcare settings. In July of 23, we had a rally outside of UCSF's hospital at Parnassus demanding that they reinstate universal masking in their healthcare settings. We met with UCSF hospital administrators in October of 23 and January of 2024, calling on them to reinstate universal masking and to make the process easier for COVID-related reasonable accommodations requests. And although we didn't get that passed, we're proud of our advocacy work there. We've also met with representatives from local and state public health departments, calling on them to keep or reinstate mask requirements at different points before and after those requirements were dropped. And then for most of this year, we focused on keeping the existing healthcare masking requirements. San Francisco had some that were remaining. So did other places in the Bay Area, like later than other parts of the state. We were focusing on keeping existing healthcare masking requirements and improving on them by fully reinstating universal masking in healthcare settings in San Francisco. And this April, we partnered with a bunch of organizations and had a rally where over 70 people showed up outside the San Francisco Department of Public Health. We called on them to keep and improve the healthcare masking mandate by keeping the requirement that was already in place for staff to mask and reinstating universal masking. And though unfortunately the San Francisco Department of Public Health refused to do it, and they allowed San Francisco's last healthcare masking requirement for staff to expire on April 30th, it was a strong, powerful showing of support, and we're proud to have accomplished that with the other great groups and individuals who partnered with us and demonstrated that it's something that has a ton of community support, and we're proud to be continuing to do this work. Thank you.
Thank you so much, Elizabeth. This is Allegra again. So now just to preview our agenda, which I'll also put in the chat. Next, we'll be hearing from organizers who have been in the thick of mask ban fights in New York and North Carolina. Then we'll hear some political grounding of how we got here, the latest public health info about COVID, and ideas for expanding our practices of solidarity. And we'll close with ways that we can all take action going forward. So now I am delighted to introduce Ngozi Alston, who's a disability justice trainer with People's Hub and organizes with Mask Block in New York City to share about what's been happening in New York.
Thank you. Hey, everyone. This is Ngozi speaking. I use they and she pronouns. I'm actually wondering if I can get some of the pictures up. Yes, thank you. So I'm part of Mask Block New York City, and a few other groups like came together to form a coalition. And around June, Pride Month, we decided to make some posters and have some comrades decorate outdoors with a mock-up like newspaper front page that says Plague City News, with a pull quote that reads, "Cowards hide their faces," says Mayor Adams. Supports bill that would ban masks at protests. Tell Mayor Adams banning masks violates New Yorkers' rights to health and privacy. Don't let them build another tool for police harassment. Hashtag no New York mask ban. And we made a similar one also targeting the governor, Kathy Hochul. So we like started pretty early, I don't say early on, but around the same time that the threat of mask bans was like sort of popping up in North Carolina.
Ngozi, this is Allegra. I'm so sorry to
Yes.
interrupt, but I'm seeing a message that the ASL interpreter was hidden when the slides came up. Sean is still spotlighted along with Ngozi from my view. Can anyone else give feedback on if that's still a problem, that Sean isn't visible? I'm seeing someone in the chats. Okay, I'm seeing many people saying, okay, I think we're good. Thank you so much. Just wanted to check in. Ngozi, please continue.
Sorry, one more thing actually while you're here, while we're paused. Could you please describe what you look like and keep continuing to describe the slides? Thank you so much.
Sure. This is Ngozi speaking. My visual description is that I am a Black disabled person wearing some red beaded earrings, a black long sleeve t-shirt, and I have purple twists. And yes, if we could move on to the next picture, please. So this is an image from the Nassau County Legislative meeting that took place on August 5th. A handful of organizers from various groups in New York City and Nassau County came together to testify against the Mask Transparency Act, which was proposed by legislator Mazie Pillup, who is a former IDF soldier. There has been a large push of Zionists manipulating false concern with their safety in response to the Palestinian solidarity encampments that have swept the globe just a few months ago. There have been a lot of disabled organizers that have tirelessly struggled to have masking policies at protests to keep everyone safe as COVID continues to mutate, with other lethal viruses looming in the not so distance. And so this image on the screen is of a group of Zionists who were like taunting and mocking disabled folks who were there to speak against the mask ban that actually ultimately passed, as you'll see in the next image, please. This is a screen cap of a tweet from Lucky Tran that says, "It's official, mask ban in Nassau County, New York passes along party lines, 12-0 with 7 abstentions. It makes wearing a mask a misdemeanor with unclear health and religious exemptions, and gives the police the power to fine people wearing a mask $1,000 and sentence them to jail time." So this has been like really like frustrating because some folks are like, we need to have health exemptions, we need to get a note from the doctor, or like, can we do this to maybe get around this? And ultimately, like, we want to express to people that like we cannot bend around this, and that health exemptions are actually very dangerous in terms of like, and just so many things in terms of like inequality and access to even like medical care or doctors in the first place, not to mention medical providers who like gaslight people for still taking COVID precautions. Like, the well of like complications is very deep here. And like, yeah, so disability justice relies on having like abolitionist frameworks and strategies. And so we do not want to make concessions with the state around something like this, because there are already disabled people who are incarcerated who are retaliated against for trying to advocate for themselves inside. And so, yeah, this is maybe the first time some people are considering that like that could be them also. And we need so much help to support people who are already disabled, incarcerated, exposed to COVID multiple times. And yes, it's just very dangerous. Like, ableism runs so deeply that they're banning masks during one of the largest COVID surges with Mpox and bird flu in the background. Like, we disabled people told folks that they were making COVID denialism. Their COVID denialism was making things so much worse for us, and we were pathologized and mocked. And it's just been really frustrating, and I'm hoping that sorry, can you go to the next is there another image or no? Yes. Thank you. Okay, so we're really hoping that like this kind of lights a fire under people. And I know folks are scared, but what we need right now the most is for people to continue normalizing masking. So this is a graphic by a comrade in New York City Mask Block that says 4 reasons to renormalize masking. The first is that apathy is violence. We need to resist white supremacy by refusing to contribute to mass infection, disability, and death. The second one is that we need to destroy the state's argument that masking is only used by quote unquote criminals to hide their identities. We need to protect mask wearers from targeting. Cops cannot single out one person if everybody is wearing a mask. And lastly, we also need to combat the exclusion and erasure of disabled people from public spaces by making them safer. The goal of fascist eugenicists is to disappear disabled people, and we refuse that. That is not going to work. And lastly, I just wanted to share a link that dropped today, that went live today, which is like a calling tool to stop mask bans, specifically focused on New York and LA. But also, if you put in your zip code to contact, your local reps you should get through to your local reps too. And I have one more image, please. This is an image from an Instagram post from Mask Block NYC again, that was about the posters that we made at the Nassau County legislator hearing. We did not get a chance to testify, although we wrote something up. So I can like put the link to that in the chat as well. But this image says, disabled people have the right to exist in public. And yeah, we shared our testimony. And so we understand that people are scared, but like what we ultimately need to do is just keep masking and fighting back, because the goal is to disappear us, and people have already been disappeared, and I don't think there are any more concessions to make. This is kind of absurd, and genocide is happening here and abroad, and in order to sustain our movements, we need to like keep each other safe and make some larger demands of our communities, of our organizations, of everybody. Just everybody has to do better. And thank you. Sorry, I don't know how much time I have left because I know I had to pause for a little bit in the middle.
Thank you. We're about at time if you're ready to start up. Thank you so much. Thank you, Ngozi, for sharing that and for all of the work you're doing on the ground. Another access note, Sean, we are getting feedback that your video is choppy. I don't know if there's anything we're able to do about that. It seems like maybe your internet is weak.
there's nothing I can do here.
Yeah,
I mean, I feel looking at myself and I'm just smoothly going.
okay, thanks. I think it just is what it is. Just wanted to check in. Thank you. All right, thanks again, Ngozi. Next up, we will be hearing from Victoria Coble from COVID Action GSO in North Carolina.
Hi, good evening. My name is Victoria Coble. My pronouns are she, her, and I'm an advisor for Mask Together America and founder of COVID Action GSO, which is a patient advocacy organization that is founded to help people in my state find safe masked healthcare. As a long COVID patient myself and a mom with 2 young children, I started a petition to fight the mask ban in North Carolina and connected with wonderful organizers from all over the world in a panic to try to combat this bill for the safety of our state. I'm honored to be given the opportunity to speak with you all and share about our experience in North Carolina with mask bans. The North Carolina mask ban dropped around the 2nd week of May this year, and we were woefully unprepared. To recap this taxing experience, I will share with you our wins, our losses, and our biggest takeaways. First, our biggest wins. We successfully prevented masking for any reason whatsoever in public from becoming an automatic Class 1 misdemeanor with no exception for medical masks or health reasons. And thank you to everyone who did that with us. We brought awareness to our state about mask bans and long COVID. We helped bring to light the issue of harassment towards maskers. Now to some of our biggest losses. This is not an exhaustive list. Any occupant of public or private property can demand we take our mask down to temporarily identify us. There's no clear definition of who is an occupant. Even temporarily unmasking can put someone at risk of exposure and infection. Police officers can demand we unmask without cause indefinitely while in their presence. Police without medical training will determine who is masking for health reasons and who is not. This is all very dangerous and unacceptable. Since the mask ban came into effect, we've had local news story headlines showcasing a stage 4 cancer patient getting harassed for masking while getting an oil change. The harasser specifically cited the bill. Unfortunately, most stories won't make the papers, and we must collect them as other organizations have wisely done. To address questions raised from some people from North Carolina, we have encouraged our masking community to do as much as possible in groups or to use a buddy system to deter harassment. This may not work in Long Island with how their bill is written, but can be done in North Carolina. We have suggested medical stickers for people who are at the most at risk of harassment by the public and police, while recognizing that this is not a safe nor permanent solution for any of us, but a measure that may be needed for some in certain contexts, like when in a courthouse or government building or anywhere this would make sense for some people. We do not have a one-size-fits-all solution. We are working hard to bring North Carolina maskers together so we can listen to how best address each of our shared and unique challenges since the ban passed. If you are in North Carolina, please reach out to COVID Action GSO on Instagram, Twitter, Facebook, or Threads, and we will connect you with other maskers in our state and with our community. And GSO stands for Greensboro, which is where we're located. Now, looking back, what we needed was a solid coalition and strategy. First and foremost, all mask bans are bad and all are serious. Debating what can be won or lost in court is moot. Mask bans kill high-risk people, and once they are infected, they may not live to see a court date. Secondly, and I'm still quite frustrated about this, we had people in North Carolina giving beautiful, passionate speeches without wearing a mask during the public hearings. I cannot emphasize enough how counterproductive that was. And everyone there who can wear a mask should have left it on during their speeches. Not masking in these hearings signaled that masking wasn't important, and it weakened our argument. Third, you may want to consider roles mapped out of who will cover social media, who is talking to journalists and media training for them if needed, who is speaking at legislative hearings, and so on. This would have helped us if we had had the time. Creating predefined roles would have helped those of us also who have limited energy and need to pace. For camaraderie in social media, you all can take mass selfies and send them together to Mass Together America, and let Julie highlight your organizing efforts for us to all share on social media ahead of the legislative hearings that are open to the public. And this is for folks who are working to prevent mass bans in their areas where this hasn't happened yet, but who want to organize and build coalitions within and outside your state and country to help prevent this. We ask people to walk the walk and please wear your masks, and not just at public protests. Our survival is quite literally threatened by mask bans. When we spoke in NC, we were lucky because we had a very different experience than what happened recently in New York. The hearing was demure, and high-risk people were able to speak about the danger this ban will create for them in our community and in our state. It caught the legislature off guard. They weren't prepared for it. We even got a few Republican House members on our side because of it. They weren't expecting high-risk people, cancer patients, organ transplant recipients, those of us with long COVID, to come forward and share our stories so loudly and blatantly with the legislative body and with journalists. And by focusing on high-risk people, we were able to demonstrate how dangerous this is for us. We also tried to get recordings of all the legislative hearings, and we posted that to social media to show how these legislators were being unreasonable to a diverse group of high-risk folks to generate public outcry that was needed to stop it. We could only get audio, but we posted what we have. Anyone who has the opportunity to get video, I would suggest trying to do that. We did, again, replay the audio on social media, and please keep in mind, if you're a person who chooses to speak at a public hearing, that some of the legislators may intentionally try to provoke you to overact. Please do not take the bait. It is a ploy to have police get violent with you. We must keep masking together, and especially in all essential spaces people must access. We cannot take any more losses on mask bans. This will kill and further debilitate people who are already dealing with very serious health challenges. We must win in the Bay Area and set an example for other places that this will not be tolerated. Lastly, these suggestions I offer to you all were made from a North Carolina perspective because that's the state I know. You all know your area best and what will be most compelling to help the folks in your area. Thank you.
Thank you so much, Victoria, for bringing us all of this experience and wisdom. And next up, we'll have Liza Mammadov from Senior and Disability Action sharing some political grounding. And Grace, you can share those slides when you're ready. And Liza and all of our speakers, please keep remembering to describe your own appearance and your slides.
Thank you. Can everyone hear me okay? Perfect. All right, my name is Liza, and I'm with Senior and Disability Action and Mask for Equity. And I am wearing a white Honeywell N95. I have curly hair. I'm wearing a green shirt, and I'm a mixed person. I'll be doing some political grounding for our event today. And before I get started, I do just want to mention that there's topics in here that are triggering. We're going to be talking about eugenics. We're going to be talking about sterilization. There's a lot of ableist related content that will be coming up here. So if you want to sit out this section, you totally can, but we'll be going over why we have found ourselves in this situation and what kinds of attitudes have contributed to the apathy that we're seeing that enables the massacre of disabled people and seniors. So next slide, let's get started with eugenics. Eugenics could be considered the ideological backbone that all reactions to the pandemic, individual people's reactions, political reactions from the state, the medical system, and public health can be based on. We'll get into why, but that's the framing that we'll be using for this part of the political grounding. Eugenics fundamentally says that there are superior and inferior groups of people. Those inferior people are weak and a burden to society, and thus they can be sacrificed for the greater good without issue. Those inferior people are also not equal members of that society in the first place. A couple of other things that we hear in the context of disability is disability is a flaw, disability is a bad state, disabled children should not be born, disabled people are a burden on society, inferior individuals should die out, and the gene pool will be stronger. Social cleansing and the purpose of eugenics. A definition of eugenics philosophy is the global scientific and social movement focusing on the manipulation of racial and ethnic stock to improve society. That also includes the unhealthy. It's a logic of culling the unfit to improve humanity. And again, consider who is considered in humanity here. In the context of COVID-19, we've created classes of people who are deemed weak and whose lives are less valuable. We choose to allow them to die, continue to die, disappear, and become more disabled. Next slide. I wish we had time to discuss the entire history of eugenics in this country, but we don't. So a little snapshot of eugenics history from 1940 to 2010. This is from a study from Laura Appelman, an article called Hiding in Plain Sight, Public Health Eugenics and COVID-19 from the Boston Congress of Public Health Review. The majority of sterilizations in the United States, when there were mandatory sterilization laws, were done in the name of public health. California and North Carolina, specifically we're talking about California here, was notorious for it. For example, they viewed sterilization as a helpful procedure that would, quote, simultaneously defend the public health, preserve precious fiscal resources, and mitigate the menace of the quote-unquote unfit and quote-unquote feeble-minded. More quote-unquote permanent solutions were sought to stem the flood, including the establishment of asylums, sterilization, euthanasia, to segregate the quote-unquote defective from the flow of community life. This article is great, and I will send it out to you all after. It also speaks about an organization called the Sterilization League of New Jersey, which was later renamed to Birthright Inc. Their main mission was to eliminate defectives. Quote, the best in every social class should be encouraged to increase, while the worst type in every social class should be helped to die out. That's a quote from the 1940s. This organization was supported by philanthropists like Henry Gamble of Procter & Gamble and many other prominent figures of society. 31 plus states had sterilization programs enduring well into the 1970s. And 40% of Native American women alive at that moment underwent sterilization in 1970. 40%. And that statistic is from an article called Native American Women and Coerced Sterilization on the Trail of Tears in the 1970s. Next slide. This is not just an issue of the past. In 2020, if you remember, there was a news story that immigrant women in detention centers on the border were forced into hysterectomies. And in California, we also saw that sterilizations of women in women's prison continued well through 2010, with a primary focus on the sterilization of Latinx and Black women. And again, I wish there could be a whole teach-in just on this topic, but let's continue and see how that relates to the pandemic and COVID-19. Next slide. Tracing the narratives that we've seen since 2020. From the first day of the pandemic, we learned, don't worry, only seniors and disabled people will die. There must be certain acceptable losses. This is survival of the fittest. Weak immune systems mean that you have weak genes. Infections make us strong. How many of you have heard this over the last 4 years? I know that I have as an immunocompromised person. The main message is that vulnerable people should either get infected or permanently isolate themselves from participating in society forever. Either they die, they become stronger through infection, which we know is not how it works, or they should just permanently remove themselves with no assistance, and we move on because they're out of mind, out of sight. At the same time, the severity of the pandemic was suppressed, and misinformation that quote-unquote healthy people were not at risk was continued in the media. So this narrative that COVID only impacts the vulnerable, who we're all okay with falling by the wayside, is problematic on multiple levels, both because of its eugenic implication and also because it's simply not true. Next slide. Here we see some prominent examples of this eugenics logic in statements from politicians. Chris Christie said, "There are going to be deaths." This was in May 2020, so only a couple of months after the pandemic started, pushing to reopen the country despite dire COVID-19 projections, pre-tests, pre-vaccine. He also said, "Of course, everybody wants to save every life they can, but the question is, towards what end ultimately?" The message is that American people have gone through significant death before. We've gone through and we've survived it. We sacrificed those lives. In the same way now, we have to stand up for the American way of life. There's also the Texas Lieutenant Governor. This was a major headline. "Old people should voluntarily die to save the economy." Next slide. And these are some quotes that a lot of us are very familiar with the CDC director, Dr. Rochelle Walensky, in 2022, saying that the overwhelming number of deaths, over 75%, occurred in people who had at least 4 comorbidities. So really, these are people who are already unwell to begin with. And yes, it's really encouraging news in the context of Omicron. We're really encouraged by these results. Fauci, in 2023, also said, "Even though you'll find the vulnerable will fall by the wayside, they'll get infected, they'll get hospitalized, and some will die. It's not going to be this tsunami of cases that we've seen." So this contributes to that logic that there's a subclass of people that are acceptable deaths, and actually we should be encouraged that those people are dying, because overall we're getting stronger and those weak people are leaving our population. Let's continue. It's no secret that COVID-19 infects, kills, disables poor, Black, Latinx, and Indigenous people and incarcerated people the most. There's a chart here that shows that nationwide, Black people have died at a 1.4 times rate of white people. This data is from the early years of the pandemic, but it continues to be true. So COVID is not only an impact that a condition that disables all of us, it's also a form of war on the poor and on racialized people. Next, let's move on to mask bans and fascism.
And Liza, we are about at time, so as you're able to wrap up.
Okay, no problem. All right, let's go to the next slide. If you could go back one slide before that. Okay. Mask bans. The implications are that there's state control over our bodily autonomy. Our bodies are no longer our own. It's the creation of new classes of criminals. The implications of that being that Black and brown disabled people will become felons. There is no way to enforce a mask ban without discrimination. This creation of classes of people that have to produce some kind of documentation to prove their sickness to the police. All young people are now protesters. All protesters are now criminals. And a massive expansion of policing and surveillance. So I do wish that we had more time to discuss the implications of mask bans and fascism, but I'll just read the next slide briefly and then we'll close. Everyone is at risk of being harmed by COVID-19 and mask bans, not just high-risk categories. Succumbing to eugenics logic comes back to bite us all. Liberation for the most impacted liberates us all. Thank you.
Thank you so much, Liza. And I saw a lot of engagement and resonance in the chat with everything you were sharing. And now we'll hear from Emmy Kane from Long COVID Justice with up-to-date public health information about COVID.
Hi, I think I have some slides. Okay, cool. Hi, everyone. I'm Emmy Kane. I use she, her pronouns. I'm co-director of Long COVID Justice, which is a project of a group called Strategies for High Impact. I'm a light tan skin, mixed race femme with brown eyes and long dark brown hair with bangs. I'm wearing a black t-shirt and 2 small gold necklaces. The slide that I'm sharing includes logos for both of the orgs, along with my name and links to our social media. Long COVID Justice is an organization by and for people with long COVID and associated conditions, building collective efforts for racial, social, and economic justice for chronically ill and disabled people in our communities. I'm about to share some pretty practical information, but want to ground in our framework that public health is not just about prevention or health outcomes, but about how we can build a culture of community care. And we see taking precautions, sharing information as part of that care. There's a lot more to our work, but we're glad to be able to step in and do this sort of basic info sharing piece tonight. Also, just a disclaimer, I'm not a doctor. Our organization is grassroots. These are just some good things that we want everyone to know based on updated information. And some of it is drawn from our forthcoming health education materials that we're producing with the Sick Times, which will be published in the next couple weeks. So the
Amy,
next slide.
I'm sorry to pause you. Is there any way that you can make your mic a little bit louder or move closer to your microphone?
Yeah,
Thank you.
sure. Sorry, is this any better?
That's a little better for me. Can people like thumbs up in the chat if that's better for you? Yeah.
Okay. Sorry about that. I'm wearing a mask and I don't have my headset on, so please flag me if it continues to be hard to hear. If we could go to the next slide. So I've been asked to just share some very basic information about COVID and long COVID and some options for prevention. So SARS-CoV-2 is the virus that causes COVID-19. It circulates year-round around the globe. It is not seasonal like the flu. We are in a surge right now, but even when we are not in a surge, there is a lot of the virus going around, which makes it important to keep a consistent prevention routine. It spreads through the air like smoke. So anytime you are indoors, you are likely at a higher risk, which can include SARS-CoV-2 being in the air from people who were there before you, even if you are alone or not near anyone else. So the 6 feet apart rule from 2020 is no longer great prevention advice. Hand washing is great hygiene practice, but transmission via surfaces is unlikely, so we don't need to bleach our groceries for this reason. Vaccines do not prevent transmission. This is a common misconception. They reduce symptoms and severity for some. You can transmit the virus while completely asymptomatic. So around half of transmission, that's 50%, is asymptomatic or pre-symptomatic, meaning you don't have symptoms or you will never develop symptoms in the course of your illness, but you can still be contagious during that time. Everyone's immune system is different, but it's good to remember that you can still infect people or be infected if a person does not have symptoms. Being indoors increases risk of transmission, but you can still get it in crowded outdoor spaces. And so we think avoiding COVID-19 is important, partially because the more times you get COVID, the more likely you are to have bad health as a result, including long COVID, which I will get into in the next slide, if you don't mind. Yeah, thanks. So long COVID is a set of health issues after somebody has an acute infection of COVID-19. That can include new health issues, ongoing issues, or worsening of previous symptoms and conditions. It is a disease that affects hundreds of millions of people. The most recent number is 400 million worldwide. It is a mass disabling condition and crisis. It can cause significant disability and it can be fatal. Anyone can develop it. Up to 10% of people who have an acute COVID infection will. And the severity of the initial infection does not correlate to the potential of developing long COVID. So it can happen even if you have a very mild or even asymptomatic infection. It can be very hard to get a diagnosis and proper treatment or care for long COVID. Every time you get a COVID infection, as I mentioned, you can increase your chances of developing long COVID. And people with or without prior health issues can develop the disease. So if you have been feeling unwell long-term after having COVID, whether or not that COVID was confirmed by a positive test, you very well may have long COVID. If you're having changes in your memory, trouble thinking or feeling foggy, that may be long COVID. It doesn't matter if people don't believe you, even if they're medical providers. As disabled people, we know what it means to have others deny the realities of our lives and bodies, and that's happening all the time to people with long COVID, which obviously is compounded for BIPOC and trans people, incarcerated people, and other already politically marginalized communities who are at higher risk of developing long COVID for a number of reasons. It's incredibly common. I think the recent number, someone here might correct me on this, but the number that we are working with is that 6% of all adults in the US have long COVID right now. And 1 in 4 have say that it significantly limits their lives. There's scientists are still studying how long COVID occurs, and we can share some links and some studies to research, links to research in the chat. And then again, every time you get a COVID infection, you increase your chances of developing long COVID. So it's part of why we think it's important to take measures to protect yourselves and others from this possibility from the sort of strictly public health perspective. The next slide, please. How do we prevent long COVID? First thing is to avoid getting COVID. The ongoing pandemic and the long COVID crisis is not any individual's fault. The systems have failed us. So part of prevention is about organizing to stop the policies that harm our communities, including mask bans, the reason we're gathering tonight. But again, because the systems have failed us, we also have to take care of each other. And these are just some of the ways to do that. We recognize that some of us live with children, roommates, or work in places that don't allow us to take precautions as much as we'd like to. All sorts of reasons why people can't do all of the things, but we also think there's no bad time to start masking or increasing your precautions. So if we use more layers or measures to protect ourselves and others, we're less likely to contract COVID. Some of this information recommendations are drawn from our health ed materials with the sick times, but also from the People CDC and a few other really great resources, which we'll also link to. One obvious thing, I feel like maybe it's not useful to share that here, but this is the basic information. Wearing a high quality mask in indoor public spaces and crowded outdoor spaces. Especially in schools, supermarkets, public transportation, healthcare facilities, pharmacies, and other essential businesses, places where immunocompromised and disabled people and workers have to go. High quality masks, when we say that, we're referring to respirators such as N95s and KN95s that fit to your face and have a good seal. Surgical masks and cloth masks are less effective. And then there are, some people here are the ones doing this work, but many communities have groups that distribute those masks for free. We can send that link around too. Another thing to do would be to ventilate your home by opening windows when possible or using air purifiers. And then when possible, especially during warmer months in this part of the world, to make plans with friends and family outside where there's naturally good ventilation. Other things are vaccines, just staying up to date with your vaccines. Continue using rapid antigen tests, molecular tests, or PCR tests before visiting indoors or unmasking with others. The rapids aren't super reliable right now. It's currently recommended that you test at least 2 times in 48 hours after an exposure or symptoms. I think they're saying that rapids are about 20% reliable in this moment. And then in combination with masking, you can use things like masking and testing, rather, you can use things like nasal sprays. There's not a lot of data, but people are choosing to use them as more research develops. I use them. There are also mouthwashes with an ingredient called CPC, which has been shown to be helpful for prevention. So again, want to acknowledge that many of us don't have full control over a COVID risk. But government agencies have failed to protect us and our health by taking away some of these safety measures. So we'll send around a tip sheet on layers of protection and recognize also this was like a lot of information. But the great news is that our organization is doing a collaboration on health education materials that are both patient and with both patient and medical review, and that will be published in the Sick Times. So we're really trying to figure out how to responsibly step up as a community organization when the medical industrial complex has failed us, and guidance around these things has been really unreliable. So we'll publish those in the next few weeks, and you can sign up, follow us on social media or something if you want those updates, or check the Sick Times. And we also have many resources on our website, including info on how to host COVID safer events, everything I mentioned above, including what to do if you get COVID, more detailed information on testing. and a resisting mask bans resource list, which includes toolkits, articles, action steps, and more from groups across the US, including work that some people on this call have done. So I'm going to drop those links into the chat. And I think I'm at time.
Thank you so much, Emmy. That was incredible. And yeah, it's just so vital and sometimes hard to stay up to date with the ever-changing information. So we really appreciate it. Next up, we'll have Gulzar, a member of Senior and Disability Action. We are going to run a few minutes over this evening. Thanks for staying with us if you can. If not, we understand, and we will share the recording. But the speakers are just sharing so much valuable stuff. So Gulzar, over to you on expanding our practices of solidarity.
Awesome. So a lot of folks have kind of touched on some of the things that I'm going to say already, and really showing the intersectionality of why masking solidarity is solidarity with each other. But I'm just gonna like really name some of those points right now as well. So masking is an act of community care and liberation. We know that the work of avoiding COVID cannot just rest on disabled and immunocompromised comrades' shoulders. We all have a stake in it. And we also know that getting COVID makes us be those disabled and immunocompromised comrades if we aren't already. We know that COVID intersects with our other movements for racial justice, for queer trans liberation, for labor rights, for environmental justice, right? We know that our QT BIPOC comrades are more likely to get COVID and have long-term effects on it, not because of our genetics, but because of the way that we are forced to interact with the world around us and the ways that the systems in place harm us. We also know that masks protect us from more than just COVID, right? We're in a place where our climate crisis is growing daily, where we're dropping billions of dollars of bombs daily that are worsening our climate crisis. And so we know that wildfires are going to worsen and other pollutions worsen as we continue, and masking will protect us from those things as well. We also know that these mask bans specifically are largely being proposed and funded by Zionists who want to criminalize protest against genocide. These are governmental Zionists and individual Zionists, such as folks who fund AIPAC. Most recently, just today or yesterday, the University of California president directed all the chancellors to enforce rules against encampments and protests. The CSUs also got a very similar letter, and it is very important that we keep the connection that these mask bans are coming at the same time that encampment bans are coming. And what are these things targeting, right? I'm going to quote the UC Berkeley SJP, Students for Justice in Palestine. I ain't reading all that. Free Palestine. We know that in New York, the governor was working with lawmakers after that hers to with what she called Jewish leaders, but we also know that there is Jews Against Mask Bans on Instagram that you can see how they're framing this as well. Ohio's was started because they wanted to advise public universities that a law to deter KKK demonstrations could also be used to impose felony charges on students who wear face coverings while protesting the war in Gaza. And we know we need to normalize masks and wear them everywhere. You know, other people have shared this as well, but someone put in the chat earlier, amazing zine called Mask Up, We Need You. In that, there's a quote from Black abolitionist Estelle Ellison, who wrote a piece called Falling by the Wayside, taken from Fauci. And she says that genocide cannot be fought by making peace with other concurrent genocides. If we are standing against genocide, Palestinians, or if we are standing against genocide of Indigenous people anywhere, or if we are standing against the genocide of ourselves by masking, we need to be in solidarity with all other movements. And we know that amidst accelerating fascism, both locally across the country and across the world, we need to resist criminalization on all fronts. The act of masking is, again, community care. So sign those petitions, do all those things that we're going to talk about in just a second. And the last thing I'm going to say is that not masking hurts all of our movements, right? Those of us who are already disabled, we know that being disabled doesn't stop us from taking care of each other. It doesn't stop us from doing the work, but it does sometimes add an extra few steps. And that will only continue to get compounded as more of us become forced to be disabled by the systems that are trying to harm us. So I'm going to stop there. I'm going to drop in the chat the few links that I mentioned, and I'm going to pass it back to Allegra to close us out.
Thank you so much, Golzar. And now we'll move into talking about what are some concrete action steps that we can all take and how can we stay connected in this work. And so I'm going to pass it over to Julie Lamb from Mask Together America. So whenever you're ready, Julie.
Yes. Thank you for having me and inviting Mask Together America to take part in this teaching. My name is Julie Lam. I founded Mask Together America, a national grassroots patient-led advocacy group dedicated to promoting masking, public health safety, and health equity. I take photographs of people who wear masks and write for Mask Together America to raise awareness about COVID and long COVID. For the past 4 years, Mask Together America has highlighted the challenges faced by disabled, ill, and immunocompromised individuals. I initiated this educational campaign when New York, where I live, was losing lots of people to COVID, including 2 of my friends. After devoting the last 4+ years to support public health, I simply can't believe that our country is now starting to ban masks and completely abandoning vulnerable people. Our government should be normalizing masking instead of taking away the last bit of protection for our survival. Wearing a mask is an individual choice. We need collective action to stop mask bans, and by collective action, I mean everyone needs to take action to stop mask bans, even if they're not directly affected by a mask ban in their state. Since HB 237, the anti-mask bill emerged in North Carolina. Working with our volunteers across the country, we started a campaign called Stop Mask Bans to mobilize supports as advocates organize action locally in the affected areas. Here are 3 ways you can join our fight. First, we have a Stop Mask Ban toolkit that I encourage you to share widely. And I am going to put this in the chat for you. So that's the chat. You'll find the toolkit. And second, we strongly encourage everyone to use our letter campaign to write to your elected officials. You should personalize the letter. And there are lots of information there that our team spent a long time to compile all the information that will help you to personalize your letter. And then third, don't be camera shy. A picture is worth 1,000 words. Take a selfie with your mask on. Hold a Stop Mask Ban sign, which is available in the toolkit. Post it yourself, or you can also send it to us and we can post it on our educational platform. Our mask selfies will help normalize mask wearing. And you can see me as an example. I'm not afraid of them. so you should not. My colleagues have discussed the mask ban in North Carolina and New York. I just want to add that I was at the Nassau County, also at the Nassau County hearing, and I saw firsthand how anti-mask legislators and police in Nassau County, New York, allow people who wear masks for health protection to be intimidated, harassed, stalked, and verbally attacked by bullies who called mask users bad actors, terrorists, and criminals. I saw with my own eyes how police treat people who wear masks so differently than anti-maskers. One of the commenters who opposed the mask ban went over time. Her wish to finish her speech was denied, and legislator Howard Coble, the presiding officer, immediately brought security in. Some bystanders left their seats to stand with the speaker. I saw an officer violently drag a masked advocate out of the legislative chamber. I testified as an immune-compromised long hauler and explained why we prefer seeing more masking. Masking is about health equity. People with compromised immune systems and disabilities and their advocates were all traumatized by the violent display of injustice in this hearing. Despite many prominent health leaders and scientists opposing it, the Nassau ban was signed into law a week ago. Nassau County, which is New York's richest county with over 1.3 million people, now makes it a crime to wear a mask in public and private spaces. And I want to talk about the health exemption with you. This mask ban set a terrible precedent. The health and safety exception in this law applies only to people wearing masks to protect their own health and safety. What that means is the exemption does not apply to those masking only to protect others. For example, if someone wears a mask solely to protect an immunocompromised household member from exposure to illness, they are not legally permitted to wear a mask in public under Nassau County's mask ban. Amazingly, even people who are sick with COVID, measles, or flu, for example, and may be contagious, are not allowed to mask in public to protect others and prevent the spread of illness. We must stop mask bans, even if there are health exemptions. We need to wear masks to protect our health for many reasons, including wildfire smoke, a problem from California to New York, and COVID-19 can rise at any time of the year, as the CDC now says. This is all very urgent because we are in a summer wave right now. CDC wastewater data report a very high level of COVID nationally with over 1 million cases daily. And we need to be ready for new pandemics because airborne infection include not only routine COVID, flu, cold, tuberculosis, and reemerging measles, but also avian flu, the bird flu, and this new very contagious and deadly form of mpox. Mask bans are unfair, discriminatory, and a big violation of human rights. Everyone should have safe access to public places. No one should have to defend their mask wearing. No one should have to prove they are contagious, immunocompromised, disabled, or have medical condition, or have to protect their high-risk family members and friends. Asking someone to unmask or to justify using protective tools invades privacy. Police are likely to enforce such laws in discriminatory ways, especially against people of color and people with disabilities. Mask bans will encourage mask shaming. Businesses may even deny entries and services to people who wear masks. So, to conclude, I ask all of you to please take action with Mask Together America. Join our campaign. And I want to make sure that you see the toolkit. I'm gonna put it in the chat one more time. Please let me know that you get it. And share your mask selfies, normalize masking, and write to your elected official, share this information with everyone. We need to take action. We need to fight for justice. Thank you.
Thank you so much, Julie. And now I'll turn it over to our final speaker, Crystal from Senior and Disability Action.
Thank you so much, Allegra. Yeah, my name is Crystal. I have light skin. I'm wearing pink glasses and earrings and a black and white Ifia bandana. Yeah, also a member of Mask for Equity and here to offer some additional action items before we wrap up. We love praxis here, so yeah, more actions. Firstly, our friends at World Health Network are hosting phone banks every single Friday at 3 p.m. Eastern to demand that electeds and tourism boards reject mask bans. It's a really great opportunity to be in space with others and take action together. Secondly, we encourage you to connect with your local mask block, spelled BLOC. Mask blocks are independent mutual aid groups that provide masks, tests, and resources to their communities for free. To find one near you, go to maskblock.org. And if you don't need to request masks because you have the means to buy your own, I highly, highly encourage you to give to your local block and ensure that others can have access to protection too. Mask blocks are largely self-funded by their volunteers, and they definitely deserve more roses and community support. So please, please redistribute some funds to them if you can. Thirdly, we invite you to plug into our California organizing. Though you don't have to be in California, Senior Disability Action is building out a network so that we'll all be ready to respond to current and potential mask bans in California and beyond. So please be on the lookout for a form to get involved in this. And if you're located in the Bay Area and want to plug into local actions here, we invite you to check out Senior Disability Action's Mask for Equity group. You can check out our website, follow STA on social media, or reach out to Liza or Allegra to learn more about joining Mask for Equity. And last but certainly not least, another loving reminder to mask. So important. We really need everybody to help normalize masking again and really embed it into our culture. To all who've been masking, thank you so much. And if you've fallen off, now is the time to jump back in. Masking in essential settings like healthcare, grocery stores, public transit are really, really critical starts. And from there, we really encourage you to try pushing yourself another step further. Can you wear one at that work meeting, for example? Can you invite a friend to mask with you? Yeah, if masking more consistently is something you'll commit to, feel free to throw a wave of emoji reactions. Would be a good note to end on. And yeah, with that, thank you all so, so much for being here with us this evening. A huge thanks to our co-sponsors, all our speakers, Kelly for captioning, Sean for interpreting, our tech and security team. These are just really horrible, challenging at times, but the phrase "we keep us safe" feels ever more instructive and important. So here's to all of us building that safer, more breathable, more livable world together, brick by brick and mask by mask. We are sending y'all so much love and solidarity and sending you lots of wishes for good care and a really good night. Thank you all so much. Bye.